Now, it is time for change. Before we discuss our innovation, let's begin with some background. As per the World Health Organization, glaucoma is the second leading cause of blindness and affects 60 million people worldwide. Up to 80 to 90% of glaucoma patients in developing countries are unaware about their disease. Glaucoma is generally related with an increased intraocular pressure. However, almost 1/3 to half of patients with open-angle glaucoma do not have an increased IOP in early stages. A fundus examination can diagnose disease, but a shortage of medical professionals rules out mass screening. Another method of diagnosis is perimetry. For mass screenings, we can quantify IOP and perform a disc exam. While these are effective diagnostic tools, there is a crucial missing piece, the visual field exam. As a hospital determined to eliminate needless blindness, Aravind is working tirelessly to address the missing component. Visual field perimetry is considered a hallmark of glaucoma and a gold standard in defining the disease. Standard automated perimeters, or SAPs, are used to systematically measure visual fields. They were introduced in the 1970s, and since then, they have emerged as the standard measure of perimetry. Despite their widespread use, there are key limitations to their use, particularly as a screening tool. These devices are bulky and require a specialized dark room and restrict patient posture. Additionally, patients with special needs might not be able to complete the test. Moreover, due to the high cost of machines such as Humphrey or Octopus, they are only available in eye care centers. The ophthalmic workforce is burdened by the time constraints of this test, limiting their time for other clinical procedures or consults.
Okay, yeah. இன்னைக்கு நீங்க இந்த ஃபீல்ட் டெஸ்ட் பண்ணீங்க பட் அது சரியாவே வரல ஃபுல்லா கரப்பு தெரியுது அத இன்னொரு வாட்டி பண்ண வேண்டி இருக்கும் ஐயா
இல்ல ஏற்கனவே 20 நிமிஷம் உட்கார்ந்திருந்தேன் அப்போ ஒரு அதே மாதிரி சொன்னீங்க இப்ப மறுபடியும் எடுத்துக்கிறீங்க மறுபடியும் அதே மாதிரி சொல்றீங்க நான் என்ன பண்ண முடியாது அது கழுத்து வலிக்குது
பட் இந்த டெஸ்ட்ல என்ன ரிசல்ட் வந்துச்சுன்னா நமக்கு தெரியாது சோ அது இன்னொரு வாட்டி பண்ணனும்
அப்ப என்ன மிஷின்ல ப்ராப்ளமா சிஸ்டம்ல ப்ராப்ளமா எனக்கு எப்படி தெரியும் ரொம்ப ஹெட்டிங்கா இருக்குது கழுத்துல வந்து இது ரொம்ப பெயின்ஃபுல்லா இருக்குது எனக்கு
ஓகே
Patients and staff alike are frustrated when repeat tests must be performed due to a high frequency of fixation losses or a poor understanding of the test. The patients often struggle to remain attentive in the testing environment, losing focus or even sleeping at times. The test is quite subjective, thus differences between test administrators can drastically affect the results. Therefore, there is a real need of an easily accessible, effective, low-cost device for perimetry.
VR is the next platform where anyone can create and experience anything.
Although commonly thought of as entertainment technology, virtual reality has numerous applications in healthcare and education, including surgical simulations, telesurgery, visualization of individual anatomical models, and more. Introducing PERI-SCREENER. It is a smart device that conducts perimetry tests in virtual reality. The system consists of a VR headset, a response button, and a mobile phone. After entering patient details like name, age, medical record number, and choosing the test type, the subject wears the device. A stereoscopic image is shown and focused using adjustable lenses.
HFA-க்கு உங்களை வரவேற்கிறேன்.
An automated voice gives test instructions and performs a trial test.
உள்ள மஞ்சள் புள்ளியின் மைய பகுதியை தொடர்ந்து பாருங்கள். எப்பொழுது வெள்ளை நிற புள்ளி தோன்றி மறைகிறதோ
The patient is instructed to look at center fixation and press the response button upon seeing any stimuli. His eyes are continuously tracked to ensure he is fixating at the center, or else he is instructed to do so. Just like standard parameters, it uses stimulus sizes ranging from 1 to 5 and intensities to 50 decibels. Standard parameters use spherical backgrounds where all stimuli are at uniform angular distances. An algorithm determines location of stimuli considering transformation due to the spherical nature of a Humphrey bowl, while the mobile screen in the device is flat. Also, it compensates for distortion at the lenses. Test results display the report, and it consists of reliability parameters such as false positive, false negative, and fixation loss. There is an immense demand and limited availability of ophthalmic doctors and technicians, and this device is easily administered, allowing it to have a far-reaching impact. Unlike traditional devices, our device does not require supervisory assistance, thus, it is scalable to screen large communities. We plan to provide our device as a free service to rural communities to collect large population databases. Data can be used by machine learning algorithms to predict and identify genetic-based patterns and geographical factors that affect glaucoma rates. Therefore, we can optimize and target our screenings to populations with higher risk factors. Once PERI-SCREENER is fully developed, anyone from around the world will be able to download the app on their smartphone or other device. Thus, the test can be performed at home and reports can be shared with physicians at the click of a button. Additionally, centralized cloud-based systems and data policies enable us to execute control over the exam quality. At the macro level, we are saving time and cost for individuals, thus strengthening the Indian economy by promoting technological growth that is made in India. This is an incremental step towards the global mission of preventing blindness in patients who do not have access to medical care.